In Washington, President Trump has received a second negative COVID-19 test result. We learned that information at a White House briefing yesterday. So Weijia Jiang is standing by in Washington. Weijia, at that briefing as well, a member of the task force, the president's COVID-19 task force, said that people are not social distancing the way they should. We heard that in the package, that she can tell by the curve that people are not doing what they should. So then that begs the question, could we see a nationwide stay-at-home order coming from the White House?
You know, President Trump has weighed in on this a lot, and he says he does not believe that is necessary, that he has faith in the governors and other state leaders to make that call, and so he has indicated he doesn't plan to do that. But last night on CNN, Dr. Anthony Fauci, who has, of course, become the nation's top doctor very quickly, said he doesn't understand why the administration is not doing that, and that's a really strong message to President Trump, and you have to imagine that he is recommending that to the president, who so far has not listened. And one explanation is this, is that, you know, we are seeing hotspots in places like New Jersey and New York, and the rest of the country is relatively behind that. So if you have a nationwide lockdown, you know, that doesn't account for the different speeds at which we're seeing the spread in different states. So there could be a flat line for New Jersey and New York coming up, and then in other states it's going to start growing. So it doesn't make sense then to have that stay-at-home order in place for those recovering states or states that have not spiked yet at all. But I do think that it's very different when Dr. Fauci is willing to say in public that he doesn't know why we aren't doing this now in order to flatten the curve. And Anne-Marie, to your point about Dr. Birx, yes, she did say that she, wanted to see that curve flatten, and you could hear in her voice that she was almost worried about the fact that it didn't seem like people were doing that. And then in an awkward episode, the president came out and said, well, actually, I think Dr. Birx meant that in some places, there's still a spike, but in other states, there's a flat line, and so that's actually something to celebrate. And he went on and on about what Dr. Birx meant. She eventually just said thank you, but for those of us in the room, it was very clear that she meant all Americans are not doing as much as they can.
Weijia, let me ask you about small businesses who will now have access to federal government loans. That's starting today, but we're hearing about when individual Americans could begin receiving their stimulus checks. What are you hearing?
So Treasury Secretary Steve Mnuchin announced yesterday that they will start sending out checks in 2 weeks to people, and that's 1 week earlier than expected. But there were a lot of questions still, because Democrats are claiming that for those people who do not have direct deposit, they could wait up to 5 months for their checks. And that's something that Mnuchin forcefully pushed back on and said that the IRS does have a portal in place to collect data and to make sure people get their money in a few weeks, although he would not commit to how many weeks for those people who don't already have direct deposit set up. On the issue of small business loans, yes, they were supposed to start today, but we are hearing some banks just simply weren't ready. In fact, JP Morgan Chase, one of the biggest banks, emailed their customers to say, unfortunately, we don't think we'll be able to accept applications for loans as we had hoped. And just a short time ago, Wells Fargo told us the same thing, which is that they're not prepared to do that. And there's 2 reasons, mainly, because one, they have to understand how the government is going to check the credit for all of these businesses that are going to be applying, and how they're going to verify the payroll, for example. The other issue is that these banks don't want to loan a single dollar until they receive some sort of guarantee that they'll be repaid in the end by the federal government. And we know that is a big number, $350 billion to dole out, but they haven't gotten any indication of exactly how much is going to be allocated to each bank. And so before they start handing out this money, they want more guidance and clarity from the government about how they're going to be compensated.
So just switching it up just a little bit, Weijia, the White House is getting a new chief of staff today. Mark Meadows is going to be, or maybe not today, Mark Meadows is starting this week, I guess, or he started this week. What a time to start a brand new job. Is he expected to make any changes at all at the White House?
You know, every time that there's a new chief of staff, of course, he usually wants to bring in his own people. And so we are anticipating that those below Mick Mulvaney will follow him out the door when he exits here. In fact, reportedly, Meadows is considering replacing the White House press secretary, Stephanie Grisham, with someone he's worked with before, or with Kayleigh McEnerney, who is currently working with the campaign as a spokeswoman. So we have not confirmed that independently, but it certainly would not be a surprise because this is a seasoned politician who has his own people. And just like we see in other businesses, oftentimes when a new leader comes in, they bring along those folks that they've already worked with, who they know do, in their opinion, a good job. And so Grisham did publicly respond to some media outlets who are reporting that she said, you know, it sounds like more palace intrigue, but she also added, then again, I've been on quarantine, so wouldn't it be ironic if I'm learning about this new press secretary from the press? TBD.
Weijia, I know you got to run because you are in these briefings all day long, but real quick, speaking on the question of staffing in the White House, Jared Kushner, who was previously in charge of bringing peace to the Middle East, is apparently now running point on the coronavirus response from the White House. Does Mr. Kushner have a medical background? Because yesterday he made a point about ventilators and the national stockpile with regards to governors who are requesting equipment and PPE, saying that the national stockpile is not for them, that they should know what's in their stockpiles and not be dependent on the federal government. But I thought, just for my civics classes, that anything that is in the national stockpile is for the states should they need them.
And there's a lot of confusion, Vlad, because you're exactly right. That is what Kushner said. And he said, you know, a lot of governors have no idea what they already have. But certainly for governors who have been dealing with this pandemic for weeks now, they know what they have and what they don't have. And so for Governor Cuomo to essentially beg for supplies, you know, it's not because he wants to stock up, right? I mean, he is looking at what's happening and unfolding in his hospitals and telling the federal government that he needs help. And, you know, it is confusing because President Trump himself said that they were holding on to those ventilators because they were expecting a surge and they wanted to be ready for when that happened so they could dole out the equipment to the states that needed it the most. And so to answer your other question, no. Mr. Kushner does not have a medical background. He does not have a military background to handle this massive, you know, supply issue that we are facing right now. But he claims that he's ready to do the job because Vice President Mike Pence personally asked him to come on board. So he's defending himself. He actually did that during the briefing yesterday and said he is well prepared for the job. But again, already he seems to be muddling the message that the president delivered just one day before him.
All right. Weijia Jiang for us at the White House. Weijia, be safe. You and your crew, we thank you very much.
Thank you.